W- Welcome everyone and thank you for joining my presentation. Today I'll discuss my research proposal on effectiveness of mindfulness stress reduction or MBSR in reducing anxiety levels in adults. Anxiety disorders are currently the most common mental health conditions in the United States, affecting about 19% of adults each year. These conditions can severely impact individuals' daily functioning, interpersonal relationships, and overall well-being. While established treatments like medication and cognitive behavioral therapy are widely used, many adults seek alternative or complementary methods to manage their symptoms more naturally and holistically. One of the most widely studied non-pharmacological interventions is mindfulness-based stress reduction, or MBSR. This program blends mindfulness, meditation, body awareness, and gentle yoga to help individuals become more present, manage stress, and reduce anxiety. Past research has shown promising outcomes with MBSR for lowering anxiety and stress levels in a variety of populations. However, more investigation is needed, especially focusing on US adults experiencing clinically significant anxiety. To better understand MBSR specific effectiveness in this group, its long-term benefits. My research question uses a comparative format asking, is there a difference in anxiety levels between adults who complete MBSR program and those who do not? This study aims to explore whether participation in 8-week mindfulness-based stress reduction program leads to greater reduction in anxiety symptoms compared to control group receiving no intervention. Based on existing literature, I hypothesize that adults participating in MBSR program will experience a statistically significant decrease in anxiety levels post-intervention as measured by validated anxiety assessment tools when compared to those with non-intervention group. John Kabat-Zinn originally developed mindfulness-based stress reduction or MBSR in 1990 as a structured 8-week program designed to help individuals cope with chronic illness, pain, and stress-related conditions. Since then, it has gained recognition as an effective intervention for a variety of mental health concerns. A comprehensive meta-analysis by Hoffman and colleagues confirmed that mindfulness-based practices, including MBSR, significantly reduce symptoms of anxiety and depression across diverse populations. Additionally, Garland provided evidence that mindfulness practices help decrease habitual negative thinking patterns, which are often linked to heightened anxiety and distress. By fostering present moment awareness, MBSR promotes improved emotional regulation and builds psychological resilience in participants facing everyday stressors. Multiple studies have consistently supported the effectiveness of mindfulness-based stress reduction or MBSR in managing anxiety and promoting mental well-being. Curry conducted a meta-analysis that revealed significant reductions in anxiety levels across a range of diverse populations who participated in MBSR programs. Additionally, Hodge compared MBSR with cognitive behavioral therapy or CBT in individuals with generalized anxiety disorder and found that both treatments offered comparable benefits in reducing anxiety symptoms. Further, the VIBE examined the effects of MBSR among university students, concluding that participants experience improved stress management, emotional regulation, and overall mental health. These findings reinforce that MBSR as a versatile and effective intervention for anxiety reduction in various populations. This study is grounded in mindfulness theory originally introduced by Kabat-Zinn. The theory emphasizes cultivating intentional, non-judgmental awareness of one's thoughts, feelings, and bodily sensations in the present moment. Rather than avoiding or suppressing distressing experiences, mindfulness encourages individuals to acknowledge them openly, fostering acceptance and emotional balance. Garrald expanded on this framework, suggesting that mindfulness fundamentally reshapes how individuals perceive and appraise stressors in their environment. Though this cognitive shift, mindfulness helps reduce automatic negative thought patterns and maladaptive emotional reactions. As a result, individuals practicing mindfulness experience lower levels of anxiety and enhance emotional resilience. This theoretical foundation supports the rationale for implementing MBSR as targeted intervention for anxiety reduction in adults. This study will utilize a randomized controlled trial design involving 60 US adults between ages of 80 and 60 who self-report experiencing moderate levels of anxiety. Participants will be randomly assigned to either an MBSR intervention group or a control group receiving no intervention. The sample size was determined by using G-Power statistical software, applying medium effect size. Cohen's equals 0.5, a significance level alpha of 0.05, and statistical power of 0.80. This calculation recommended a minimum of 52 participants to reliably detect a significant difference between groups. To account for the potential participant dropouts or attrition during the study period, the sample size was increased to 60. This ensured the study maintains adequate power to detect meaningful effects, presenting the integrity of the results. Anxiety levels for both the intervention and control groups will be measured using the Generalized Anxiety Disorder 7-item scale. The scale is well validated, reliable, and widely accepted screening tool for assessing anxiety severity in both clinical and research environments. Participants will complete the scale at baseline and again after 8-week intervention period. Hypothetically, it is expected that participants in the MBSR group will show a significant reduction in their average scores, decreasing from a mean score of 13 to approximately 7. In contrast, the control group scores are anticipated to remain relatively stable. To determine whether the difference between the groups is statistically significant, an independent sample t-test will be conducted to compare post-intervention scores. The hypothetical analysis for this study would indicate a significant reduction in anxiety symptoms among participants in the MBSR group compared to the control group. Based on the anticipated results, the independent t-test would yield a p-value of less than 0.05, demonstrating statistical significance. Additionally, effect size measured using Cohen's D is expected to be around 0.80, which is considered a large effect. This suggests that MBSR program produces meaningful and substantial reduction in anxiety symptoms for adult participants. Further supporting the effectiveness of mindfulness based interventions in managing anxiety. Future research could expand on this study by evaluating the long-term benefits of MBSR on anxiety management, assessing whether improvements are sustained over the months or even years after completing the program. It would also be valuable to compare MBSR to other established treatments such as cognitive behavioral therapy or pharmacological interventions to determine relative effectiveness and cost efficiency. Moreover, future studies could target specific subgroups to explore whether MBSR offers unique benefits for particular populations. For instance, veterans experiencing post-traumatic stress disorder, postpartum mothers managing perinatal anxiety, or individuals living with chronic illness may respond differently to mindfulness-based programs. Tailoring interventions to meet needs of these distinct groups could improve outcomes and broaden the clinical application of MBSR. This approach would strengthen evidence for its adaptability across diverse clinical and demographic populations. For this study, I'll use a 95% confidence level, which is standard in psychological research, to balance the risk of type 1 errors with sufficient statistical power, detecting meaningful differences. This confidence level ensures that if a significant effect is found, there is only 5% chance it occurred by random error. Unlike many previous studies that concentrated on clinical patients or university students, my research will focus specifically on U.S. adults aged 18 to 60 who report moderate anxiety symptoms. This broader community-based sample aims to provide fresh insights into the effectiveness of MBSR in general adult mental health. In conclusion, mindfulness-based stress reduction, or MBSR, is well-supported, evidence-based intervention shown to effectively reduce symptoms of anxiety. What makes this proposed study valuable is its focus on general adult population rather than specific clinical or student groups commonly represented in existing research. By targeting adults between 18 and 60 with moderate anxiety symptoms, this study will provide broader community-relevant data. The anticipated findings could help inform clinical decisions for mental health professionals, primary care providers, and public health policymakers who seek effective non-pharmacological interventions for anxiety management. Additionally, by demonstrating the benefits of MBSR in general adult population, this research may encourage healthcare system to adapt or expand mindfulness-based interventions as affordable, accessible treatments alongside the traditional ones. Ultimately, this work contributes to growing body of research supporting holistic, person-centered mental health care approaches.